Howdy everyone, Matt and Mateo here, and we're coming at you with another orthopedic special test. And this one is in the cervical spine. This is the first test I remember learning when we got to the cervical spine. So that first day of ortho, I believe it was ortho 2, because that was ortho 2 was the complete spine. We started with this test, and we were told it's super important. You want to, really know this one because it could help people. If you suspect anything bad, it could mean that there is something really sinister going on. And if you haven't guessed it, it's called the Sharp-Purser test. As we know that the Sharp-Purser test is looking at the integrity of that transverse ligament way up top there at the AA region. And if we suspect that that is torn or damaged in any way, this test could identify it, and you want to refer that person for, like an immediate medical attention. So, a little history about this test. This test came from a paper in 1962 by Dr. Sharp and Dr. Purser. They were doing research on patients with rheumatoid arthritis and ankylosing spondylitis, and they were looking at the displacement up there at the AA region. And they were more looking at like the signs and symptoms and the presentation that people were coming in with that had this confirmed diagnosis, but they also did this test and said, oh, if you do this test, there could be a displacement as well, because they confirmed it with radiographs in their test. So how they did it, they had the person there, took the one hand, had it on the palm, had the palm on the forehead, their thumb on the spinous of the axis. I'm gonna get in there. Now Mateo's a little stiff. And then we'd have him flex a little bit and then push back. There. So I'm pushing this straight back. And they said if it's, in their paper, they said if it's actually severe, you would actually see movement. I believe they only saw it in one person, that they did have a very severe displacement. But in their test, in that paper, they found that more people had pain with this test. So there is variations to the test. Now, what I learned in school and how it was presented to me was a little different. So the setup is almost the same. The setup is the same, excuse me. So the person is there, you have the hand on the forehead, but we use this pincher grip right there on that axis, and we translate backwards, but we're also kind of giving a little forward movement there. And we're feeling for excessive motion. So that's what, when I was taught, like if you feel like it really goes, or a clunk or a click. And that's that dens in there moving. So it's moving and clicking. So one of my CIs, I remember telling me, you can do one where you like kind of pushing in. If you hear like a, sorry Mateo, that it would be a positive. Now this test is not without some controversy. So there was a paper that came out with some systematic reviews, and they kind of overall said this test isn't very reliable, this test isn't very valid, and so it may not really find out a whole lot. Well, somebody wrote into the editors about that paper and said, well, if you look at the stuff that he is saying, it's a good test for ruling in an instability. So they said if you have a positive with it, it's most likely that they do have a positive. Now, I do believe that there is some with the intra-relator reliability. I have run into that as well. That when I've had somebody else test, they said no, that that didn't feel, when they came out, I felt like there was some. They tested it, said no, and they didn't really feel like that. So I can see that this really could depend upon the clinician. So if you maybe been practicing longer, you may feel stuff a little bit different versus not. Now, in Dr. Sharp's and Dr. Purser's paper, they did talk about the presentation of many of these patients that have a cervical displacement. And they said, one, that they're going to have pain. Now, their test was, they said it was painful for many of the ones that were positive. But these people typically will have a pain in the neck region, around in that area, that will go up to the occipital and then also into the temporal region. And they said it was made worse with jarring motion. So they said like riding in the car, that bouncing, they said it would cause pain as well. They also said this person had a hard time returning their head back to neutral from looking down. So if they're looking down, they had a hard time bringing it back up. Or if they were looking up, they couldn't, with shaving, which was their words, which I have not done in a while, they had a hard time bringing it back here. Or they felt like their head was going to fall forward. And lastly, they said they had a very flattened curve as well, with possibly some torticollis. Now, with this test, what again, things I've learned is that you look at a lot of their signs and symptoms, you know, the mechanism of injury. So yes, if somebody was in a car accident and they suffered a whiplash through something, we would want to test this. If they have rheumatoid arthritis, possibly you want to test it. Now there is some controversy with that as well, because they said this test could be dangerous because you are getting that motion in and you could be hitting the spinal cord. So they said this test could be a little dangerous. It could cause harm. But again, in that letter to the editor, they said this really was an opinion as well. So that was someone's opinion, that there isn't any data really to show that it is dangerous. And of course, along with the testing, that, you know, the other stuff. So if somebody is presenting with the 5 Ds or the 3 Ns, you know, those things, okay, possibly there's some instability that we would want to refer out there. So there you go. That's the Sharp Purser test. And let me know, do you use this test? Have you ever done it? Have you ever found a positive in anybody? Or what do you think about it? Please share it down below. If you also happen to have any other things that you're interested in finding out about, I'd be happy to present those. And like always, take care of yourself, take care of your patients. We'll see you next time.